Good afternoon. My name's Dr. Richard Roberts. I'm head of the Vaccine Preventable Disease Programme in Public Health Wales. Thank you for those who've submitted questions. I'll be having a go at answering some of those this afternoon. So the first question comes from Darryl Griffiths. Thank you for this question. He says, my friend in a care home has had her first vaccine in January and since then has tested positive for COVID and is now out of isolation. Is she able to have the second dose soon? So this is a very common occurrence in care homes where we've had a lot of COVID infection. The guidance around having vaccination after COVID is to wait a month if possible. So a month from the onset of symptoms, assuming that you've got better, or if it's asymptomatic, a month from the positive test. And then to have the vaccination after that period. Sometimes for various reasons it's not possible, so it is possible to give it within that period, but where we can, we like to separate those vaccines by a month, and the same would apply to a second dose as in this case. So you would wait a month after the start of the infection for the infection to pass completely and then give the second vaccine. This next question comes from Nancy Harris, so thank you for your question, Nancy. The question is, in view of reports about AstraZeneca vaccine, do you think it gives us older people a good cover of immunity? So as you've have seen in the news, there have been reports just this week actually about a small study in South Africa of 2,000 people, young people, average age 31, where the AstraZeneca vaccine didn't perform very well in preventing mild symptomatic infection in that group, so with a very low level of protection. This has to be taken alongside a lot of other evidence about the effectiveness of the vaccine against the UK strain, which is the one here currently. We have had some imports of the South Africa strain, but that's not common in the UK and isn't yet established here. So in terms of the vaccination against the current strain, both the current vaccines show very good effect against the UK variant of the vaccine. So that's the most important thing in deciding whether to have the vaccine now. In future, vaccine manufacturers may provide vaccines against other strains, such as the South Africa strain, and that is a possibility. But the most important thing now is to have the vaccine that works against the strain that is here already. And it's also important to mention that for some of the vaccines, we do have good evidence that these vaccines work against the South Africa strain in preventing severe disease. So this would be hospitalizations and deaths. And because all these vaccines work on the basis of protecting you with the spike protein, and the spike protein is the same one as is used in all the vaccines, we'd expect all of these vaccines, including the AstraZeneca, to offer a reasonable level of protection against severe outcomes from COVID, which is what we want a vaccine to do. The next question comes from Cindy Davis. Thank you for this question, Cindy. And the question is, please can you list all the side effects of Pfizer vaccine? My mum has been really ill in bed for a week after having it. She has no underlying health issues. Thank you. So thank you for this question, Cindy. It's an important question about what people can expect after vaccination. And the very large studies of 20,000 or more people from the trials and our experience of giving vaccine now to over 10 million people in the UK is that the majority of people may have a sore arm after this vaccine, so that's very frequent. A minority of people then will feel unwell, so they may feel tired, maybe off their food. They may have a fever, a very small proportion may have a fever, but the vast majority of people just have those local symptoms of soreness and a heavy arm, with most not having any general symptoms. So it's quite unusual for these symptoms from the vaccine to last more than 2 or 3 days. So we know that from the study. So the illness that you describe your mother having of being in bed for a week, really doesn't sound like a vaccine adverse effect. It possibly could be, but it wouldn't fit any of the data that we have from the trials where the adverse effects really in 99% of people clear up just after a few days. So it may be that it's something else that has caused this illness, and that is a possibility. So in general, people do suffer adverse effects on the vaccine, but the vast majority of people, that is just a local sore arm, and a few people then will feel under the weather for a few days. In terms of listing all the side effects, these are available on the MHRA website. So if you were to Google MHRA Pfizer vaccine, you could go there and then look at all the side effects of the Pfizer vaccine in the documentation on that website. The next question is from Rachel Basanko. So thank you for your question, Rachel. And it is, why is someone with a healthy immune system having COVID antibodies? Why would they still need a vaccine? So that's a good question. The way that I would answer that is to say, if you've had an illness and had a positive test, it probably will mean that you will have protection from your antibodies and cellular immunity for a number of months, and that should prevent further infections. But having a vaccine after you've had that infection will boost your immunity, so it will prolong that period when you're protected against that strain of COVID-19. And we do know that protection against COVID-19 wanes over time, so that boosting will mean that the period when you're not going to get COVID will be extended. So it's definitely worth having a vaccine after you've had COVID-19, and you would normally leave at least a month between the onset of your illness and having the vaccine. Karen Watson has asked a question, so thank you for this question, Karen. And it is, I've had a severe reaction to amoxicillin and also to naproxen. Is it okay for me to have the vaccine? So two specific medicines there, one an antibiotic and one a painkiller. But if I answer generally about reasons not to have the vaccine, so the only two reasons that you shouldn't have the vaccine is either a severe reaction to the vaccine itself, so your first dose, or to an ingredient that's known to be in the vaccine. And the most common ingredient would be PEG, polyethylene glycol, which is in the Pfizer vaccine. So if you have an allergy to either the vaccine itself or an ingredient in it, you shouldn't have it. For others, like you, Karen, who have had a reaction to other things, you can have these vaccines, but there may be certain conditions that we would want to offer you the vaccine in. So if you've had severe reactions to a number of different medicines, we may recommend a different vaccine for you, so to have not the Pfizer vaccine but the AstraZeneca vaccine, or we may recommend that you have that vaccine in a place where you can be observed for longer, with facilities that if you were to have a reaction could be treated quickly. So it is an important question, and it's important for those with severe allergies and reactions to medicines, foods or anything else to realise they can be vaccinated, but give that information to those who are going to be vaccinating them so that they can take precautions. So thanks for that question, Karen. This next question comes from Sharon Poppy. So thanks for this question, Sharon. And it is, will you need to continue to shield if you've had 2 COVID vaccines? So this is the question that we all want answered, when we'll be able to stop shielding. And the answer is not yet. So even though you've been vaccinated, you will still have to observe hands, face, space to keep yourself and other people safe. And the reason for this is that the vaccines that we currently have give us very good protection against symptomatic COVID disease, and particularly good against severe disease, so hospitalization and death. But we don't yet know for all the vaccines whether they protect us against catching and passing on the virus without symptoms. And that's the key thing about needing to continue to observe that hands, face, space message. We know that for one of the vaccines, there is some emerging evidence that in about 2/3 of people it does prevent that, but it still means that in 1/3 of people they can still pass on the virus after being vaccinated, even if they're not ill themselves. And for the other vaccine, the Pfizer vaccine, we don't yet have any information that would help us with that. So we all need to continue to follow the rules and keep ourselves and others safe. So those are the questions for now. Thanks to everybody for sending them in. Keep sending in your questions and we'll try and find answers for them. In the meantime, do stay safe. Remember, hands, face, space. Keep yourself and those close to you safe from COVID-19. And we'll hopefully see you again soon.